Apart from the different types of hematuria that we have discussed, and yeah, we've discussed them almost like 8. All right, we have the transient hematuria, the persistent hematuria, we have the microscopic hematuria, the macroscopic hematuria, and the rest. You will notice that most of the times the treatments they have like one or two or three or four treatments that are basically the same, because hematuria is hematuria. So here now we're trying to put out all the possible treatments for hematuria. All right, we try to put it like in the same one video. All right, just put it like in one video. So just for revision's sake, what is hematuria? Hematuria is more of like, okay, you're passing out urine. You are passing out blood in urine. Okay, so the different type of hematuria just simply depends on what is the quantity of blood being passed out, or what is the duration of the blood being passed out. Do you understand? So that was just it. Let's talk about the possible treatment for hematuria, which is basically blood in urine. Okay, so blood in urine don't really just start up like that. All right, most of the times it has an underlying cause. Okay, there's another disease condition which is basically causing this blood in urine. Do you understand? So you might want to actually tackle the underlying cause first. All right, you might want to actually tackle what is causing blood in urine, okay, which is not normal. All right, so this hematuria can range from benign. Okay, sorry. The possible causes can range from benign to life-threatening. Okay, now let's talk about some common treatments. If you are having infections from, let's say, bacteria, you might want to do some antibiotics just to deal with those bacteria. Okay, examples we have are urinary tract infections or kidney infections. So if it is bacteria, you might actually want to opt in for antibiotics. All right, then kidney stones. If it is kidney stones, you might want to do pain management and analgesics, right? Then you increase your fluid intake, right? When you are taking water, you increase the way you take water just to help pass out small stones from that site. Then you can also do a surgical removal or extracorporeal shock wave lithotripsy. All right, and this is a type of treatment for larger stones. So if you're having larger stones that are basically blocking the urinary tract, you might want to actually do this type of treatment for it. All right, then if the cause is cancer, right? If this cancer that is causing you to basically urinate with blood, you might want to do a surgery. All right, you might want to do chemotherapy, radiation therapy for bladder, kidney, for bladder cancer, kidney cancer, or prostate cancer. Okay, then if it is basically inflammation of the glomerulus, okay, that's the glomerulonephritis, you might want to take drugs like corticosteroids, immunosuppressants, or other medications. All right, and this is basically just to reduce inflammation. All right, just reduce inflammation. Right, so this picture just illustrates for infections. All right, infections is mostly like from bacteria, so you use antibiotics. All right, then if the person is having prostate issues, so you can take medications for benign prostatic hyperplasia, or you take medications for prostate cancer, or if it is prostate cancer, you do the same type of medicine, or sorry, same type of treatment that we're basically talking about when we're talking about cancer. Right? Then trauma. If it is trauma, you might want to do supportive care, surgery, or embolization just to control bleeding. All right. Then medication induced. If it is medication induced, that's like you are taking some drugs like aspirin and anticoagulants. Okay. Their side effects is that you can bleed, you can do some internal bleeding, and can make it pass out blood in your urine. Okay, so you might want to actually discontinue. All right, discontinue the drug, you stop taking it totally, or you can just adjust it. Okay, you can just adjust the drug, or you stop taking it totally. Do you understand? Then if there are other causes, you can treat underlying conditions, because most of the times there are some disease conditions that are basically causing um, you to pass out blood in urine. Okay, so you might want to treat those conditions, you tackle those conditions. And some of those conditions can include sickle cell disease or bleeding disorders like hemophilia. Hemophilia, which one again? I actually knew a lot of these things from physiology. I still know them though, right? But we most of the time skip, okay? Then in addition to addressing the underlying cause, general measures may include, you can also increase what fluid intake to help flush out the urinary tract, okay, just to ensure that there are no stones and all the stuff. Then urinary tract rest, reduce fluid intake or avoid irritants. Pain management with analgesics, and monitoring what kidney function and urinary urine output. Okay, that's it about what treatment, like treatment for different types of hematuria. I think that's how I even named this video, right? Because this is quite much more comprehensive, right? So that's it for this treatment for different types of what hematuria. Okay, guys.